HIV and cancer.
Good morning, good afternoon, good evening, depending where you dey watch me from. My name still remains Bitola Esther Ogechi. I'll be your host for today's show. On the topic, together we can combat against HIV in our community. And with me here, we get our ogbonge guest, Mr. Michael Gorinji from the CSCC Ughelli North Delta State, aka Paparazzi. You're welcome to the show.
Thank you so much. It's an honor to be here, actually. My name is Gorinji Michael Sunday. I work with Ughelli North CSCC. I'll be the adherence counselor. Thank you so much.
Our lovely viewer out there, una know the matter now. We don't come again the way we take the come. And today we want to discuss about early testing and early treatment. So you don't say we get our professional person will be say in feed. Now in feed for to educate us on early testing and early treatment. So Mr. Michael Gorinji, you go get some question what I would like ask you. And I would like make you educate our audience out there. They would like learn a lot from you today about early testing, the reason why person supposed to go doing HIV test, and the benefits of those tests. So all these things now will lead me to this question when I would like ask you, as the adherent counselor where you be, why is early HIV testing so important for individual and community?
Well, thank you so much for that question. Early HIV testing, it is very, very important to individual and community. Number one, one of the benefits where I go fit talk now, we say once you test your HIV, it will give you that edge for you to start your treatment early. Based on say if the person dey positive, but if you dey negative, another thing we say it go help you when you take what they call PrEP or PEP. Now PrEP and PEP na prevention medicines where person wey no get HIV they take. Then ART na drugs where person wey get HIV they take. So that early testing go fit give you edge for you to say, okay, as I test myself, whether I dey negative or I dey positive, help still dey for me. You understand? Then another thing we say, it go help you to take up infection for you to infect others. Now, if you dey positive, once you start your ART, your viral load go down, and once your viral load go down, it go reach where you go take your ART, your drugs. It go reach where you go take them. It go reduce them to the barest minimum. Which one? The barest minimum, what would they call U is equals to U? That is undetectable is equals to untransmittable. Once you take your drugs, reach that level, you know go fit transmit HIV, give another person. So now the benefit of testing early be that, because if you know test early, the viral load will be plenty, and anybody where you meet, say when I say meet, I mean say you sleep with the person, the person feel contact that. Say you mingle more with the person
without protection.
The person go get the HIV. You understand? So early HIV go feel reduce the spread of HIV. Why? Because if you test yourself,
when the person test himself, you know his status,
early. You go fit help him to choose better options so that he no go feel reinfect. Because another thing you say, if you know they infected, you they affected. Now the thing be that. So early HIV they help for that aspect. Early HIV testing they help for that aspect. Another thing we say, it go help you plan your life. Because if you dey positive, you go plan your life. Why? Because you don't already dey aware. Because another people they talk say waiting you don't know, it pass you. But once you know them, you go fit plan your life. So now one of the things.
Like for the communities now, maybe say I know say some communities go there, they know they like, maybe if they don't see people say they won't come out, they come out to do HIV test. Once they hear that HIV test, everybody they bagger.
People they run. Oh.
So they go back and say, HIV people now don't come again now for now. Nothing when una know they carry come pass to come do HIV test.
Oh,
so what you go like tell those community people where be say they always they
well, so another thing when I feel even talk about that thing now be not this kind of sensitization they okay. You understand? Because lack of knowledge, if you make people they do all of those things. You understand? Because they lack the knowledge to say, okay, if I say me you go do malaria test now, that kind of stigmatization no good day.
Okay.
Why? Because now HIV and the way they don't take stereotype the HIV, the way HIV take come out, the way they don't associate HIV, say if you get HIV now because you do waka, kurukere waka and all of those things. Now it makes so people that's fear of stigma still there.
Okay.
Now the reason why people when they see say you carry say you want to do HIV test for the community, they go the fear. Because
the reason why I asked you this question, yes. I feel remember you get one certain time where we say search now we come out say we won't go on community. I know go like ask call the name of the community. Okay, you understand? So immediately they just see search team say they don't drop their things, say they won't use they do that HIV test now. When they go meet the gatekeeper, say we don't come or won't do test. Now everybody say I beg, mona hold there. Now know they pass HIV.
Sure, you don't see her.
We no want. We no want do this test. So like those kind community now. Waiting you think say we fit do those kind people we go make them feel say HIV na normal thing, na normal sickness the way other sickness they like malaria, typhoid, headache. Because I believe say if you get headache, you go take paracetamol or you understand, so that it go calm you down. So for those people where be say they feel say once you don't test for HIV, I believe say maybe now one of those things where they make them fear. Once you don't test for HIV, automatically when you come out positive, it don't mean say the person know the next thing you go buy, you know, get life to live, or all the dream where the person gets, it go just buy like that. So in that kind of scenario, now wetin you go fit tell our audience out there where they listen to us and our community people. I know say una dey hear us o, and I beg if I get any question to ask our adherent counselor, then una drop am for comment section. So wetin you feel say you fit tell our people?
So like just like wetin you don already talk already. Now some of this misconception wey been done dey, you understand, and all of this misconception boils down to lack of awareness. Okay. And I really want to thank you people for giving a platform like this for us to even educate people on about HIV. So one of the strategy now having a show, a talk show like this will help. Then another thing we say, government needs to do some policies wey go favor people wey dey live with HIV. I know say some policies dey already from ground, but they need to, you know, say they fit do policies, but they no enforce them, or the visibility of those policies no too dey. Like
person wey discriminate person now, or you can't go cast person HIV status.
Yeah, you cast.
I remember say policies dey wey be say if you guys go take disclose person status, they fit arrest you. You get time where you go use.
You get fine wey they even talk say they go even pay fine. Say if you discriminate person wey get HIV, or you stigmatize person wey get HIV, person fit carry you go court. Okay. And if you carry you go court, depending on the severity of it, they go fit jail you or you pay fine. Okay. You understand? So some of those policies, if they go fit bring the policy, the visibility of those policies, if the people, and then to educate people where they live with HIV, let them know their rights. Okay. You understand? Because if you don't know your rights, you go suffer. You go suffer. Person if you just come violate them. But the awareness of you knowing about your rights, it go fit help you to tell say okay. So one of the things where I go also talk where go fit help for that talking about the stigmatization and the discrimination about the HIV. When una come say una want test, they go say una don't carry una self, come with una HIV wahala and all of those things. Now sensitization, you understand? We no go talk past waiting with the talk now. Now sensitization, and also to tell people about the benefits of testing, and also the benefit of even if you test, even if you no get the HIV, you get other benefits of prevention where you go fit get. So all of those things, if we put them in place, take educate people, I think it will change the narrative.
Okay, as a adherent counselor where you be,
Yes,
and now your feed be that, and we know say you sabi your work well. I would like ask one question. It still relates to this our conversation where would they get?
okay.
Like for people where be say they don't do their HIV test, they come out positive. After some time, they can't stop to they take their medication, or they go back go do test, and the test results can't they show negative. What you guys tell those people? Because I don't they see a lot of people where be say they tell me say they don't already heal from HIV because they take medication, they don't take on to one particular level, and now they test negative.
So this thing will happen. I go relate am with something wey just happen recently for my facility. A get person wey come go meet our lab scientist. He come tell us say he wan do HIV testing, and this na person wey don dey on earth already for our facility.
Okay.
So she come tell am say why you wan do HIV testing. He come talk say they tell am say if he do HIV say if he don't take this drug for a while, say he go come test negative.
Okay.
You understand? Now it's possible say they go test that person, he go show negative. It's possible. Now why? Because of the drugs where he dey take, it dey suppress the virus. You understand? If you reduce the virus to the barest minimum, where you go come to that level when they call the U is equals to U. So at that moment, if you suppress the virus, some people they stop to take their medication at that moment.
So waiting be the danger of that stopping that medication.
Yeah. So now where I want carry you go be that. So when make I no deviate from the story when I dey tell you. So she come tell and say why you want test the HIV. So he can't tell her say then tell her say he go suppress. She can't tell her say so all of this problem they boil down to I go associate them with some professionals where they try give hope to some of their clients. Yes, it's good for you to give hope, but then it's good for you to also tell the client
the
reality on ground. Now I like give this scenario or this example. If I carry one seed of rice and I throw one for inside river, shebi that seed of rice still dey for that river. Abi you know, yes. Abi you know dey, e dey abi you know dey. E dey. Now e be like HIV. Now if you don't take these drugs, you can't remain that like say na that particle of that rice wey dey inside your body. E dey that river. If you leave that rice for inside that river, that rice will grow. Abi normally rice they grow for damp area now. That rice will grow, and if one rice grow, you know they produce one rice, it is plenty. So if you leave that rice when I give you example, now be the HIV. If you leave them say you know they take the drugs again, it go germinate back. Now that germinate now be the replication. Where would they talk? Now if it replicate, one thing where this virus now very intelligent virus. Now very intelligent. I talk with with our pharmacist, and they tell me about the intelligence of this virus. This virus will change itself based on say the virus we don't they analyze say you know they take the drugs, and once you don't analyze say you know they take the drugs, the ones where they replicate now different strands of the HIV, no be that same HIV will be in your body. Now different strand we go come dey more stronger
than the former
one. Now that one na go come cause drug resistance. You come dey take these drugs, the drugs no go come dey work for you. So now one of the things with that, the danger of you starting to take these drugs and say you know continue to take the drugs, say because you test you come say you dey negative. The danger be say the drugs fit no come dey work for you, because the virus will develop resistance. Do you understand? And it will come cause wetin we dey call treatment failure. And if you continue to dey do am like that, you will come notice say you will come enter HIV stage 2.
I'll be one ask you that question. Say, how many stage now we get for this HIV?
So we get stage 1, we get stage 2, we get stage 3.
Okay, you fit explain the stage 1, stage 2, and stage 3 for our
So the stage 1 be say okay, now that one wey dey go na HIV asymptomatic, e no get symptom.
Okay.
You understand? You fit dey healthy like I dey kakaraka like this now. Person fit still get HIV for him body, but e no symptoms yet. You understand? That one na asymptomatic, say e no get symptom. You understand? Then when you don begin dey see some stages, you know, when you don come dey go toilet, dey go dey stool and all of those things, na that one you don that's HIV symptoms don dey show for your body. That one you don dey enter stage 2. You understand? And all of this. So person wey dey for stage 1 fit look healthy. You understand? And majority of people wey na why they talk say HIV no dey show for face. Majority of the people wey dey diagnose with HIV, they no dey actually know say dem get HIV until they go do the test.
Because they dey stage.
You understand? Because dem dey stage 1. So you fit dey for stage 1, if you dey stage 2 na when the thing don dey show for body. Stage 3 na when the person don dey near one pack up.
Okay.
You understand? And all of those things. So that stage 1, e good make person maintain that stage 1. Because person wey even dey for stage 2 sef no dey even dey look good. His skin sef no dey even dey look good. Whether he even dey still dey take him drugs well, he go still, because already you don default for stage 1. Yeah.
Thank you. So our lovely ogbonge people, shey una hear wetin our oga Mr. Michael Gorinji, aka Paparazzi. You know why they call am Paparazzi? Because e dey burst my head. You know the matter now. Una hear wetin him talk o. So HIV, e dey real, and una hear e get stage 1, stage 2, stage 3. Abeg, for you not to enter stage 2 or stage 3, make you go do your HIV test o, because if you know your status early, e go fit make you manage yourself. A lot of people wey you dey see around wey dey waka, you no even know whether they even get HIV because of wetin dey dey stage 1. So abeg, know your HIV status because e dey very very important. Early testing dey very important. No wait until when they don dey carry you gegegege dey go hospital, or when you don dey stool dey sick up and down before you go come do HIV test. And mind you, that thing wey you dey hide, if you allow am worse reach that level, e go be wetin, e go dey exposed. Thank you very much, Mr. Michael Gorinji.
Yes.
Abeg, wetin you get to tell our audience out there? Which advice you go like give them?
Well, just like wetin we don dey discuss since, early detection of HIV, e dey save life. So
Okay.
I will encourage our viewers out there, not be until when you sick before you say you wan go do your HIV testing. Normally they dey talk say every 3 months to 6 months you are supposed to do your HIV testing. You understand? So like they used to talk, like I don talk before, if you are not infected, you are affected. Yeah. So the thing be say na networking. The thing so you need to test yourself, right, to know your status. Because if you know your status, you go fit plan your life based on say you go plan your life whether na prevention you go do abi na treatment you go do. So na wetin I get to tell our viewers wey dey there. Thank you so much for listening.
Thank you, sir. Our lovely ogbonge viewer, thank you very much. I remain your girl, Ibitola Esther Ogechi. See you on our next video. Bye.
Searching